what is the way people access care? So can they do it through an app? Can they do it on a desktop? Can they speak to somebody, do that online? Are they able to filter through different therapists? Because somebody might want to see a male and not a female. Somebody maybe want to see somebody with their ethnic background. Maybe they need to see them in the morning, in the evening. Essentially, we know people with mental health conditions get better as long as we reduce the barriers into getting help, and then we don't have long wait times. I think a good way to look at it is all the opportunities that an employer may have in their workplace to address mental health. Really nice, because when you look at that way, there are low cost, lower load strategies that you can take, and then also integrating with a mental health solution like a paid program, a third-party vendor. High level there, I always say one of the best things that you can do just initially is starting with the top down, meaning that C-suite, HR, leadership, anyone that's in a people leader position is trained in some sort of mental health like leadership training. So think mental health first aid and also suicide prevention.
Can you expound a little on the concept of mental health first aid?
Thank you, Jeremy. I knew you were going to ask, and I was hoping.
I feel like I might kind of know what that means, but I would love to hear what you have to say about that.
Yeah, that's a great question. So we have CPR, right? If somebody were to become unconscious, we train people in first aid, CPR, what that looks like. But historically, really, we haven't talked about mental health crisis or somebody with a worsening mental health condition. Mental Health First Aid is an organization that has a training, and somebody has to become certified to do it. But essentially, the training is a full day training. Is not for clinicians. This is for leadership, employees. It's for anybody in the public really could take it. How to recognize common mental health conditions, how to speak to them, how to appropriately give people recommendations. They had them meditate for 26 minutes, maybe 26, 27 minutes a day for 8 weeks. Think about that. That's 2 short months. I mean, tomorrow it's going to be Christmas. We know that. Like, I'm waiting to go to the store and Christmas trees be out. Meditate every day. They took imaging of their brain before and after. So the structure in your brain where we have anxiety, fear, that grew smaller. And the part of our brain where we have empathy, introspection, memory grew bigger. In 8 weeks of just breathing.
Wow.
I don't have any
6
medicine
breaths
that
a
can
minute.
do that. Yeah, I mean, that is just amazing. So essentially, when we become stressed, overwhelmed, burned out, or have an untreated mental health condition, 2 parts of our brain downregulate. We go into that stressed fight, flight, or freeze response. And our frontal lobe, where we make good executive thinking, that's not working as well. And also in the back of our brain, our hippocampus, that's where we retain memory. That also kind of goes to sleep while we're in this stressed state. So the employer may have said a million times, hey, we have this EAP, or we have Spring, or Headspace, or you name it. But at that moment, it's just like, it's gone. Like, there's nobody there in that part of the brain to bring that back.
Being a kid, right? Like a young person, and then to have social media later on top. Yeah, I can't even
imagine.
It hurts to think about it.
MySpace didn't happen until I was in college. I can't even imagine the stuff we got away with, man.
Right?
Oh, I know. No videos,
the stuff
no
we
evidence.
did, like, we wouldn't have done half the stuff we did if social media was a thing.
Right.
It's crazy to think about.
We know from the research, if children spend more than 2 hours, and thinking children, adolescents, spend more than 2 hours on social media, they're at 50% increased risk for depression.
This has been a Shut Up production.